There's a version of this story where Camilla's collapse makes perfect sense on the surface. A woman in her late 70s, living at the center of the world's most scrutinized family, suddenly overwhelmed. Exhausted. Depressed. A lifetime of pressure finally catching up. It's a sad portrait. It's also, according to the reports, a manufactured one, and the timeline is where the whole picture starts to crack. Because when you line up the dates, something strange appears. The health crisis reportedly did not creep in gradually, the way genuine burnout usually does. It didn't follow months of visible strain, no quiet whispers from staff about sleepless nights or dwindling energy, no slow withdrawal from public duty. According to palace insiders, it surfaced with what looks like unsettling precision. At almost the same moment King Charles III made clear he intended to hand his sister, Princess Anne, control over the royal family's private finances. Not before that decision. Not long after it. Inside the same window. And in a palace where every move is supposed to be deliberate, that alignment is either a tragic coincidence, or it's the single most important detail in the entire story. To understand why that timing matters so much, you first have to understand what and was actually being given. This was never a ceremonial role with a flattering title attached. Reports say Charles was preparing to place her at the head of the privy purse, the financial machinery that manages the monarch's private income, the cost of running the household, the salaries and budgets and allowances that keep the entire institution moving. Control of the privy purse isn't a reward. It's leverage. It decides who gets funded, whose projects survive, where money flows inside the palace walls. For all practical purposes, it is the financial backbone of the crown. And putting and in charge of it was, on paper, the most logical decision Charles could make. And has spent a lifetime earning exactly that kind of responsibility. She's known inside the palace for arriving early, staying late, and treating minor engagements with the same seriousness other royals reserve for state occasions. She doesn't tolerate wasted time, wasted money, or the kind of institutional bloat that quietly grows when nobody is willing to ask hard questions. So when the king looked around his household and saw spending that didn't add up in structures nobody seemed brave enough to challenge, the fix he chose was simple: give the problem to the one person in the family who would actually solve it. But for Camilla, that decision reportedly landed like a direct threat to everything she built. Because whoever holds the purse strings holds access. If and took over, Camilla's ability to shape what happened inside the palace, her resources, her reach, her standing, would shrink overnight. And beyond the money, there was something harder to measure and possibly more wounding. Trust. Charles trusts Anne completely, and that confidence was earned over decades of quiet, unglamorous reliability. Camilla, by contrast, has spent years fighting to be seen as more than the woman who married into the crown. Watching the king hand his deepest confidence to his sister instead of to her, sources claim, was the moment something inside her shifted. And that, according to the allegation, is precisely when the illness appeared. Not gradually. Not with warning signs anyone noticed in advance. Reports describe it as sudden, a sharp deterioration that arrived almost exactly when she learned of the plan. A private physician in Chelsea reportedly produced an official medical document diagnosing her with severe mental exhaustion and major depression, the sort of clinical language that would stop any partner cold. And here's the part that makes this episode genuinely uncomfortable to examine. According to the claims, that document did not reflect a real decline. It was arranged. Sources allege Camilla reached out to the doctor directly, asked him to prepare a report blaming her condition on relentless public pressure, and offered financial compensation in exchange for a diagnosis her body had never actually produced. If that's accurate, then what followed wasn't a woman struggling with her health. It was a woman performing it. Reports say she began presenting herself to Charles looking drawn and depleted, carrying the kind of exhaustion she wanted him to see. Tears at carefully chosen moments. Pleas framed to sound wholly selfless, that taking responsibility for the privy purse would give her a sense of purpose, that the work itself would be what helped her heal, that by handing her the exact authority he'd planned to give Anne, he would be giving her a reason to recover. Step back and look at that maneuver honestly, and it's quietly brilliant. It takes a position of weakness and converts it into a demand for power. She wasn't asking him to slow the transition down. She was asking him to reverse it entirely, and to do it in her name, motivated by compassion for her health. And for a moment, it may have been working. Charles reportedly wavered, caught between his plan to reform the household and his instinct to protect his wife. It's a hard place for anyone to stand, and she knew exactly how to hold him there. But then, according to the reports, she went further, and that's where the mask began to slip. She reportedly asked for something that had nothing to do with recovery, a written commitment transferring the late Queen Elizabeth II's symbolic jewelry collection to her and to her children from her first marriage. Not a loan, not a future promise, a written transfer, raised in the middle of a conversation supposedly about her mental health. Pause on that for a moment. If the goal was to heal, why jewelry? Why inheritance documents? Why financial security for grown children with no claim on the crown? Those aren't the requests of someone trying to get better. Those are the requests of someone trying to lock in her position before the door closes for good. Princess and, according to the account, had been watching closely the whole time. Missing details isn't in her nature, it's the trait that defines her entire reputation. What she noticed, allegedly, was a pattern in Camilla's behavior. Whenever the king left the room, the phone came out. Quiet conversations, held in a hushed tone, conducted with a sharpness that did not match the image of someone barely holding herself together. And reportedly tested the observation, and the pattern held every time. So she took a step that was both simple and audacious. She placed a trusted person inside the household staff assigned to Camilla's quarters, with one job: to document what was actually happening. What that person eventually captured, according to reports, were the contents of Camilla's phone, call logs, message exchanges, a trail of repeated contact with a single number. The same Chelsea physician whose name sat at the bottom of the medical diagnosis. Over and over again, in the weeks leading up to the crisis. At that point, and apparently stopped investigating and started confronting. Reports say she went to the doctor's clinic directly. No warning, no intermediaries, no polite requests through official channels. The physician initially defended his work, insisting the diagnosis had followed proper medical procedure. But when and placed the call records and message exchanges in front of him, the defense collapsed. He admitted that Camilla had contacted him, that she had offered payment, that the diagnosis was fabricated, and that no genuine medical evidence supported the claims of exhaustion or depression. A spoken confession, given freely, in the presence of the one person in the family least likely to let it slide. Now imagine that scene from Charles's side. Weeks spent worrying about his wife's health. A major financial decision set aside out of compassion. And then his sister walks into his study with a file showing that the entire thing was engineered. The tired face, the tears, the private pleas, the timing of the collapse, all of it staged to steer a king's sympathy toward a particular outcome. Reports say Charles sat in silence as in laid out the full picture, the fabricated report, the financial arrangement, the pattern of manipulation, and what it all pointed toward. Not recovery. Control. The purse. The jewelry. The inheritance. The crisis wasn't a cry for help. According to the evidence, it was a strategy wearing a hospital gown. The king's response, as described, was swift and formal. Instead of a private conversation or a quiet resolution, he reportedly convened an emergency meeting of the royal council, and brought the doctor with her as a witness. Standing before the assembled members, the physician repeated his confession, every fabricated indicator, every instruction Camilla had given, every payment that had changed hands. With that testimony on record, there was no room left for denial. The performance was finished. And the judgment, by all accounts, was absolute. Reports say Charles revoked every previous consideration of Camilla's authority, stripped her of control over resources and budgets, removed her access to royal finances and inheritance, and ordered that she leave Buckingham Palace that same night. Not a separation, negotiated over months. Not a cooling-off period. An expulsion, carried out immediately, with guards instructed to enforce it. Whatever she packed in haste, reportedly in silence, with no argument left that could change the outcome. The scene practically writes itself. A consort standing in the palace courtyard as the night closes in, asking the man she'd shared half a lifetime with how he could treat her this way. But the question worth asking isn't why he was cruel. It's why she was surprised. Because measure what she claimed against what the evidence showed, and the contradiction is impossible to miss. She said she was overwhelmed by public pressure, yet she had the composure to orchestrate a months-long deception. She said she wanted to heal, yet her demands were about money, jewels, and inheritance. She said she was too fragile to carry responsibility, yet she proved strong enough to run an operation sophisticated enough to fool a king. Almost. In the end, the reform Charles had planned went through anyway. The finances stayed exactly where he'd originally wanted them, under Anne's oversight. And the aftermath still leaves questions hanging over the palace. Will Camilla retreat quietly to a private residence, or will she push back through allies of her own? Will her children from her previous marriage challenge the revocation of those promises about the jewelry? Will the palace ever issue an official statement, or will it let the silence speak for itself? Those questions are real, but they sit beneath a larger one about the monarchy itself. Because this wasn't only a personal betrayal. According to the account, it was an attempt to redirect royal resources and symbolic treasures out of institutional hands and into private ones. Precisely the boundary the palace has spent centuries defending. The crown and the individual are not supposed to blur. And when someone tried to blur that line from the inside, the institution responded the only way it could. As for Anne, She leaves this story as the figure nobody saw coming. The sister who doesn't seek attention, who doesn't chase headlines, who simply does the work and notices when the pieces don't fit. She could have looked away. She could have assumed the best and let events play out. She didn't. And that's the quieter lesson buried under all the drama. When someone asks for power and points to their own suffering as the reason, the question isn't whether the pain looks real. It's what the pain is being used to purchase. And if you're going to build an elaborate deception, the safest place to attempt it is probably not under the watch of someone whose entire life has been defined by paying attention. Because in the end, this crisis was never really about Camilla's health. According to everything reported since, it was about what illness can buy when it's performed well enough. And what it bought her in the end was the opposite of what she wanted: a king's trust reduced to ash, a palace that closed its doors on her, and a story that will shadow her for the rest of her reign, a cautionary tale about what happens when ambition dresses itself up as a breakdown.